Celebrities Wanda Sykes, Angelina Jolie, and Christina Applegate opted for double mastectomies to avoid what they feared was inevitable. Other, less famous women have suffered through traditional breast cancer treatments, many without ever exploring any other options. It doesn't have to be this way. The Hampton University Proton Therapy Institute treats breast cancer. It is well known that lives are saved here, and when cancer strikes, the Hampton University Proton Therapy Institute, the world's largest freestanding proton therapy center, stands as an excellent choice for the treatment of cancers of the prostate, breast, brain, spine, lung, head and neck, GI, and pediatric. Air Force veteran and cancer awareness activist Lawrence Davis fought to get the treatment he knew would make the difference for his prostate cancer. He sought funding for the treatment from the Veterans Administration to no avail and put boots on the ground quite literally to get the word out.
Have you had your mammogram?
And in October of 2014, Davis took that first step toward healing.
Say now, bring on the protons.
Thanks to the generosity of those who support the Gala of Hope, his dream came true.
Hey! We made it! Yes!
But another segment of our society can equally benefit from proton therapy. Breast cancer is the most common form of cancer found in women, affecting millions. Roughly 300,000 new cases are diagnosed each and every year in the United States.
My cancer being on the left side, I was really hung up on it being so close to my heart.
I had breast cancer on the left breast, making it even more difficult as far as radiation is concerned. Because in this area, you have to worry about accidentally radiating the heart, the lungs. And with traditional radiation, that's exactly what would have happened.
One of those most common side effects that we see is women can develop heart disease, especially if the cancer is on the left side of the breast.
The advantage of proton therapy for these women is it gives them the benefits of radiation in reducing the local recurrence without the long-term side effects of radiation to the coronary vessels.
And what about the rates of reoccurrence of cancer after radiation treatment? Is proton therapy a better choice?
A big study that conducted by the Massachusetts General Hospital from Harvard University, looking at hundreds of patients that have had X-ray radiation or proton radiation. And we see that those who have had proton radiation have about half as much risk of developing a secondary cancer as those who have had X-ray radiation.
And what about those women who went to the extreme, like comedian Wanda Sykes, to have both breasts removed when cancer is found in only one? Was that decision driven by the fear that cancer would also develop in the healthy breast? Well, a recent study published in the Journal of the American Medical Association found that survival rates for breast cancer patients treated with surgery and radiation compared to those who opted for a bilateral mastectomy were virtually the same. So along with surgery and chemotherapy, HUPTI provides women an alternative to the mutilating results of mastectomies.
The data that we have published from the institutions that have done this, very exciting, very good results, and very low side effects.
I expected all kinds of burning, all kinds of pain, all kinds of peeling. However, it was no worse than a regular sunburn. And I used aloe vera that took care of it.
Some tenderness to the skin, but no burns. And the healing was fast. The color of the skin came back relatively fast.
Lung cancer treatment is also a focus of the Institute.
We are also treating patients with those lesions that are on the outside of the edges of the lung where we can just give the treatment in 2 weeks. Cancer's gone.
And HUPTI is not resting on its laurels. They've been hard at work upgrading their facilities to include pencil beam scanning technology. With this, protons are delivered with far more accuracy in less time and with even fewer side effects.
Is ideally suited for patients with irregularly shaped tumor volumes, head and neck tumors, base of skull tumors, tumors around the spine. Protons by themselves are ideal because we treat no tissue beyond the tumor, but now we have a way of further refining it going to the tumor.
This is especially important in the treatment of pediatric cancers. Radiating healthy tissue in children can cause developmental delays, hormone deficiencies, and even hearing loss.
We had done surgery, we had done chemotherapy. That was not keeping the tumor at bay. We knew that radiation was our next option. With him being so young, I did a little research. I wanted to try to find the safest option, and proton therapy was the safest option.
After my proton therapy, I feel great. Feel I can be able to do anything I want, get out and get active.
That sentiment is echoed by nearly every HUPTI patient. People who have been given their lives back from a technology, from a staff, and from an institution dedicated to fighting cancer and saving lives.